Hi, I'm Phil and I'm a late diagnosed autistic older adult. In this video, I want to look at a list of terms and concepts that are closely related to autism. Also, if you are interested in seeing more videos about my experience of being autistic and issues important to autistic adults, please hit the like and subscribe buttons below. This lets me know that I'm not just talking to an empty room and helps get the message out to a wider audience by letting the YouTube algorithm know that people are interested in this topic. Before we begin, an important point to note. Autism is a spectrum of challenges and abilities. As such, no two autistic people will have the same experience and the same traits. Also, this is just a very quick overview of these concepts, so if you would like more detail on anything that I discuss here, please leave a comment and I will endeavour to add it to my list of videos to come. As well as this, if you have watched my earlier videos, you will see there is some repetition here, but the purpose is to try and capture all this in one place. So if this is the first video you have found, you will still get a good overview. Okay, let's dive in to part 1 of 28 terms and concepts related to autism. Number 1, monotropism. Developed initially by autistic researchers Wen Lawson, Dinah Murray, and Mike Lesser, monotropism is the tendency for attention to be pulled more strongly towards a smaller number of interests at any given time, leaving fewer resources for other processes. This concept can explain nearly all the features commonly associated with autism, directly or indirectly. This form of hyperfocus makes it hard to redirect attention, including starting and stopping tasks. This leads to what is often described as executive dysfunction. In the monotropic mind, interests that are active at any given time tend to consume most of the available attention, causing difficulty with other tasks such as conventional social interaction. Monotropic individuals have trouble processing multiple streams of information simultaneously. Number 2, executive dysfunction. Executive function describes the cognitive skills that allow you to do things like pay attention, take in and remember new information, stay on task and ignore distractions, multitask, regulate emotions, adjust behaviour in line with the change in environment. Executive dysfunction might manifest in things like misplacing things, difficulty in managing time, forgetting appointments, difficulty starting tasks, keeping your workspace organised, difficulty dealing with frustrations or setbacks, difficulty remembering information or following directions that have multiple steps, challenges with impulse control, emotions, mood or behaviour, and having trouble putting complex thoughts or abstract concepts into words. Number 3, stimming and ticking. Stimming is a term that refers to repetition of physical movements, sounds or words, or the repetitive movement of objects. Stimming helps autistic people regulate their emotions as a response to sensory overstimulation or situational overwhelm. This might be as a response to stress or anxiety, but equally as a response to joy or happiness. Ticking is closely related to stimming, but might be thought of as more sudden or abrupt movements, typically less rhythmic than stims. Tics occur in about 22% of people with autism compared to about 3 to 4% of the wider population. Simple tics have two main types: motor tics, which involve things like eye blinking, shoulder shrugging, head jerking, facial grimacing or muscle spasms, and vocal tics, which involve things like throat clearing, grunting or sniffing, or repeating words or phrases. Complex tics involve more elaborate movements or vocalizations that may appear more purposeful, such as touching objects in a certain order or uttering phrases. Number 4, pathological demand avoidance. Pathological demand avoidance is a condition where a person constantly avoids even the most basic demands, responsibilities, and expectations. This might mean that the conditioned response of the person with PDA to any question is no. In autism, this tends to manifest with the autistic person resisting external demands placed upon them with a need to be in control of their own destiny. This leads to the alternative positive focus description of PDA being labelled a persistent desire for autonomy. Number 5, rejection sensitivity dysphoria. People with rejection sensitivity dysphoria have an emotional reaction to negative judgments, exclusions, or criticism beyond what most people feel. Other people might see those with RSD as being overly perfectionistic, overly sensitive, or overly reactive to even the mildest types of criticism. People with RSD might bend over backwards to accommodate other people's needs at the expense of their own needs in a response called fawning. Number 6, autistic inertia. Autistic inertia comes from an analogy of Newton's first law of motion, which is known as Newton's law of inertia, and states, a body remains at rest or in motion at a constant speed in a straight line, except insofar as it is acted upon by a force. The autistic version of this is that if an autist is doing something, we will likely want to keep on doing it and not know when to stop. This also includes not realising when we need to eat, drink, or go to the toilet. This is especially true if we are working on a special interest. Likewise, this means it's hard for an autistic person to start a new task or switch tasks. Autistic inertia is linked to monotropic focus, in that the autistic person tends to focus on tasks one at a time. Number 7, Asperger's syndrome. Asperger's syndrome is an outdated diagnostic classification for autism to describe an autistic person who has above average intelligence, good language skills and creativity, but has the typical range of autistic communication challenges. In the current diagnostic framework, this diagnosis would typically be categorised as Autism Spectrum Disorder Level 1, with the Level 1 classification denoting requires support, as distinct from Level 2 requires substantial support, or Level 3 requires very substantial support. Number 8, Savant syndrome. Savant syndrome is a condition where someone demonstrates exceptional ability in one area, such as art or mathematics, despite significant social or intellectual impairment. Savant syndrome is distinct from autism, but about half of those with the condition generally have a neurodevelopmental condition such as autism, or conversely have experienced a brain injury. The other half often have some form of central nervous system disease. Savant syndrome affects about 1 million people globally. It is estimated that between 0.5% and 10% of autistic people have some form of savant abilities. Number 9, high and low functioning autism. Functioning labels are no longer used or encouraged. Historically, high-functioning autism was classified as someone with no intellectual disability or delay in verbal speech development, and whose symptoms of autism has less of an impact on their daily life. Typically, this label would have been given to someone who had been given a diagnosis of Asperger's syndrome. In the current diagnostic system, the equivalent would be Autism Spectrum Disorder Level 1, denoting lower support needs, as discussed earlier. Labelling someone as high-functioning may be to downplay the daily struggles they experience. Conversely, labelling someone as low-functioning may deny them opportunities through discrimination and also may deny their potential or dismiss them entirely. Number 10, comorbidity. Comorbidity is a term used to denote the presence of more than one diagnosis in an individual at the same time. There are several comorbidities commonly associated with autism. Some of these are ADHD, Attention Deficit Hyperactivity Disorder, a complex neurodevelopmental disorder that affects attention, behaviour and emotions. OCD, Obsessive Compulsive Disorder, a mental and behavioural disorder in which an individual has intrusive thoughts and feels the need to perform certain rituals repeatedly to relieve stress. ARFID, Avoidant Restricted Food Intake Disorder. Tourette syndrome, a neurological condition that causes unwanted involuntary muscle movements and sounds known as tics. EDS, Ehlers-Danlos syndrome, a group of inherited conditions that affect joints, skin and blood vessels. POTS, Postural Orthostatic Tachycardia syndrome, which causes dizziness and fast heartbeat when you stand up. It can also cause fatigue, brain fog, blurred vision, and headaches. Dyslexia, an unexpected and persistent challenge with acquiring and using written language. Dyscalculia, a learning disorder that affects the person's ability to do maths. Dyspraxia, a brain-based motor disorder that affects fine and gross motor skills, motor planning, and coordination. CPTSD, or complex post-traumatic stress disorder, a stress-related mental disorder generally occurring in response to complex traumas. Whereas PTSD, post-traumatic stress disorder, can occur as a result of being exposed to a single traumatic event, CPTSD can occur as a result of repeated exposure or long-term exposure to trauma. GAD, generalized anxiety disorder, a mental health condition that causes fear, a constant feeling of being overwhelmed, and excessive worry about everyday things. At number 11 on our list, we have alexithymia. I've given this one a dot point of its own as it is very common in autistic people. Also, alexithymia is not technically considered as a diagnosis, but a personality trait. So what is alexithymia? It's a difficulty in identifying or describing emotions. The misconception here is that autistic people are emotionless, or have suppressed emotions, or even a complete lack of empathy. The reality is usually quite different. Autistic people are more likely to experience very strong emotions. Where the difference arises is that we might not be able to express the emotions we're feeling in words or project that in a neurotypical way. This can manifest in some autistic people having what is known as a flat affect, which is displaying a more muted range of facial and/or vocal expression. Likewise, autistic people often experience a hyperempathy way beyond what neurotypical people might experience. But autistic communication differences may mean we do not always convey that empathy back to the other person in an expected way. Number 12, delayed processing. Delayed processing in autism is where there is a delay in processing and thus responding to incoming information. The information is stored in the brain and processed when the brain load is lower or has spare capacity. This delay might be from processing any of the physical sensory inputs, but might also affect the timing of how emotions or even grief is processed. This might also manifest as a delay in someone responding to verbal input or instructions, where there appears to be a short period before the autist can respond. But equally, the autist may need time to go away and process the information before returning with a response. This delay can also affect things like hunger or thirst, and might even mean an autistic person does not know when to stop eating because of the delay in processing when we are full. Number 13, the double empathy problem. First coined by autistic researcher Damien Milton in 2012, the double empathy problem is a theory that the difficulties faced by autistic people when socialising with non-autistic people is due in part to a mutual lack of understanding between the two groups, rather than solely being caused by the autistic person's communication challenges. Put simply, when people with different experiences of the world interact with one another, they may struggle to interact with each other. This was put to the test in a 2020 study by Catherine Crompton et al. This involved a game of telephone conducted by 3 groups, where a message was relayed in whispers from person to person. The 3 groups consisted of one group with 8 non-autistic people, one group of 8 autistic people, and the third group a mix of 8 autistic and non-autistic people. The autistic group and the non-autistic group both relayed the message with reasonable accuracy, but in the mixed group, the message quickly degraded. This showed that when people of the same neurotype, either all autistic or all non-autistic, interact, they can communicate effectively, but when the 2 neurotypes are mixed, a communication breakdown occurs. In fact, the autistic-only group had the highest accuracy, although only by a small margin. As stated in the report's discussion, these results challenge traditional assumptions of autistic social impairment. The findings are inconsistent with the social cognitive deficit narrative of autism. Number 14, echolalia and palilalia. Echolalia is the repetition of words or phrases spoken by someone else. While this is common amongst toddlers as they learn language, it can persist in people with autism and other neurodiversities throughout life. It can also include repeating sounds heard in the environment. It is considered to be automatic and involuntary, and may happen immediately or be delayed. An example of echolalia may include repeating lines from TV shows or movies, sometimes years after the show was watched. Palilalia is the repetition of words or sounds from the person's own speech. Both echolalia and palilalia can serve the function of self-stimulatory behaviour. Number 15. Hyperfocus, special interests, research mode, and info dumping. Autistic people, both children and adults, will commonly have topics of extreme interest that they focus on intently. These special interests may be lifelong or may come and go over time, but the common feature is the hyperfocus that the autistic person has when engaged in their special interests. This hyperfocus can make it hard for the autist to break their concentration to attend to other daily needs, such as eating, drinking, or even going to the toilet. These special interests can be in just about anything, but some common topics include things like trains, space, Barbie dolls, Lego, Minecraft, animals, and many more. These special interests may mean that the autistic adult retains a focus on something that others might consider age inappropriate, as they've held that interest since childhood. These interests are normal and should not necessarily be discouraged. For example, there is a well-known autistic researcher and communicator who has a special interest in My Little Pony. Research mode. Research mode is an extension of this and usually happens when the autist wants to discover everything possible about a new topic of interest. This can occur when watching TV and the topic inspires interest that needs to be researched in great detail, often while still watching the TV show. Info dumping is the act of telling usually a person close to us about our latest discoveries in our special interests. In my case, this often happens when my wife is trying to wind down at bedtime and I info dump with great excitement and detail about something. It's not always well received at that time of day, however. Okay, so that's it for now. In the next video, we will keep going with this list. If you want to find out more about what autism is, what it isn't, and why I decided to get an official autism diagnosis, please feel free to check out my two-part video of my introduction to autism. I will leave a link to that in the video description. And remember, if you want to see more videos on my experience with autism, please hit the like and subscribe buttons below. Thanks for watching. See you in part 2 of 28 autism-related terms and concepts. Just follow the link. Bye.